Current data show that approximately 8 million Americans suffer from gout, with the majority being adults over the age of 60. This makes gout one of the most common forms of arthritis in the elderly population. Gout is a metabolic disease characterized by elevated levels of uric acid in the blood. When uric acid accumulates excessively, it forms sharp crystals that deposit in the joints, causing intense pain, swelling, and inflammation. These symptoms often lead to decreased mobility and reduced quality of life, particularly in older adults. Because the risk of gout increases with age, it is especially important for individuals over 60 to be aware of preventive measures and early management strategies. Factors such as diet, hydration, and weight control play a significant role in lowering uric acid levels and reducing the frequency of gout attacks. 1. Cherries. Cherries have demonstrated notable potential in supporting the management of gout, a form of inflammatory arthritis caused by elevated levels of uric acid in the bloodstream. These fruits are rich in anthocyanins, a class of potent antioxidants with significant anti-inflammatory properties. These compounds may help in reducing serum uric acid levels, thereby potentially decreasing the frequency and severity of gout attacks. Several studies have indicated that regular consumption of cherries or cherry extract correlates with a reduced risk of recurrent gout flares. The effect appears to be most pronounced when cherries are consumed alongside prescribed gout medications, suggesting a complementary role rather than a replacement for pharmacological treatment. They can be consumed fresh, frozen, or in the form of unsweetened juice. However, it is advisable to avoid cherry products containing added sugars, as excessive sugar intake is known to exacerbate gout symptoms. 2. Coffee. Coffee has increasingly been studied for its potential impact on gout management. Interestingly, regular coffee consumption has been associated with lower serum uric acid levels and a decreased risk of gout development in several epidemiological studies. The exact mechanism by which coffee influences uric acid levels is not entirely understood. However, some researchers suggest that coffee may increase the excretion of uric acid through the kidneys. Moreover, coffee contains chlorogenic acid and other polyphenol, which may exert antioxidant and anti-inflammatory effects, contributing further to joint health. It is worth noting that both caffeinated and decaffeinated coffee have shown similar benefits, suggesting that the positive effects are not solely due to caffeine. Additionally, coffee consumption has been linked to improved insulin sensitivity, which may indirectly support uric acid regulation since insulin resistance is a known contributor to high uric acid levels. Despite these findings, individuals with gout should approach coffee intake with moderation. Excessive consumption may cause other health concerns such as increased heart rate or gastrointestinal discomfort in sensitive individuals. 3. Dairy products. Dairy products such as milk, yogurt, and cheese play a significant role in the management and prevention of gout. These foods are low in purines, the substances that break down into uric acid in the body, and are rich sources of protein and calcium, which contribute to overall health. Scientific studies have demonstrated that regular consumption of low-fat or fat-free dairy products reduces serum uric acid levels and decreases the risk of gout attacks. This effect is attributed to the presence of specific proteins such as casein and lactalbumin in dairy, which promote the excretion of uric acid through the kidneys and inhibit its formation in the body. Furthermore, dairy intake supports weight management, an important factor because obesity increases the risk of gout. Clinical research involving thousands of participants has shown that individuals consuming 3 or more servings of low-fat dairy daily have a significantly lower risk, up to 44% less, of developing gout compared to those who consume fewer servings. It is recommended that adults incorporate 3 servings of low-fat or fat-free dairy products daily, where 1 serving equals 1 cup of milk or yogurt, or approximately 40 grams of cheese. 4. Fiber. Dietary fiber plays a crucial role in the management of gout by influencing the metabolism and excretion of uric acid. Fiber is a type of carbohydrate that the human digestive system cannot fully digest or absorb, which allows it to pass through the intestines, aiding in regular bowel movements and overall digestive health. High-fiber foods help reduce serum uric acid levels by several mechanisms. First, fiber slows the absorption of purines, the compounds that break down into uric acid, thereby reducing the amount of uric acid entering the bloodstream. Second, soluble fiber binds to uric acid in the intestines, promoting its elimination through feces, which decreases uric acid reabsorption into the blood. Numerous studies have demonstrated that diets rich in fiber are associated with a lower risk of gout development and fewer gout attacks. Increased fiber intake also supports weight management, an important factor since obesity is a known risk factor for gout. Nutrition guidelines generally recommend a daily fiber intake of 25 to 35 grams for adults, which can be achieved by consuming a variety of fruits, vegetables, whole grains, legumes, and nuts. 5. Green tea. Green tea is widely recognized for its numerous health benefits, including its positive effects on gout management. Green tea contains powerful antioxidants known as catechins, which help reduce inflammation and oxidative stress in the body. Studies have shown that green tea can enhance kidney function, promoting increased excretion of uric acid through urine. This helps lower serum uric acid levels and reduces the risk of gout attacks. Additionally, green tea's anti-inflammatory properties help alleviate joint pain and swelling associated with gout. Moreover, green tea supports weight management and improves insulin sensitivity, both of which are important factors in controlling uric acid levels. Regular consumption of green tea, when combined with a healthy diet and lifestyle, can contribute to lowering the frequency and severity of gout flare-ups. It is recommended to consume green tea in moderation, typically 2 to 3 cups per day, to gain its benefits without adverse effects. 6. Apple cider vinegar. Apple cider vinegar, ACV, offers several beneficial effects that may support individuals managing gout. ACV enhances kidney function, facilitating the efficient elimination of uric acid from the body. This process helps in maintaining healthier serum uric acid levels, which is crucial for reducing joint discomfort associated with uric acid accumulation. The acetic acid present in ACV contributes to creating a more alkaline environment in the body, which can inhibit the formation of uric acid crystals, a key factor in joint inflammation. Furthermore, ACV contains polyphenol that possess strong antioxidant and anti-inflammatory properties, aiding in the reduction of inflammation and oxidative stress in the joints. In addition to these effects, apple cider vinegar supports metabolic health by assisting in blood sugar regulation and weight management. Both of these factors are important in maintaining overall joint health and reducing inflammatory responses. For optimal benefit, ACV is typically consumed diluted in water, and moderate use is advised to minimize potential side effects such as gastrointestinal discomfort or dental enamel erosion. Thank you for watching this video. In summary, managing and preventing gout requires attention to lifestyle choices, including diet, hydration, and regular physical activity. Incorporating the right foods and habits can significantly reduce uric acid levels and lower the risk of painful gout attacks. However, it is crucial to remember that no dietary changes or natural remedies should replace professional medical advice. Always consult your healthcare provider before making significant changes to your diet or treatment plan, especially if you are over 60 or have other health conditions. If you found this content helpful, please like the video and subscribe to our channel for more informative health and wellness content. Your support helps us create more videos tailored to your needs. Stay healthy, stay informed, and take care of yourself. Until next time.